Well, good morning. Hope your day is off to a good start. Thank you for joining us. Michigan State University has taken a different approach to providing medical education for future doctors. We'll talk about that today. It starts right now.
From TV6, this is The Ryan Report. Here's your host, Don Ryan.
The medical school at Michigan State University is uniquely positioned for students to receive comprehensive training in settings that closely parallel the environment in which many physicians practice. Students spend some of their time at the MSU campus in East Lansing, but the college differs from many medical schools in that there are also 7 locations across the state, and the doctors in training spend time in one of more than 50 affiliated outstate hospitals and facilities. One of those campuses is here on the Upper Peninsula. Dr. Stuart Johnson is the CEO and Community Assistant Dean at the UP campus. Today we'll learn more about him and the program. Dr. Johnson, welcome to the Ryan Report.
Thank you.
Nice to have you with us.
Pleasure to be here.
Now, let's give our audience a chance to get to know you before we talk about the program. You actually grew up in Marquette, I believe.
I did. My my parents moved here to Marquette in 1972. He became the Director of Data and Telecommunications at Northern Michigan University.
Okay.
I was 2 years old at the time and was one of 10 children. They added 11th child here in Marquette. And so basically I've grown up here, raised here, love the UP.
And I know that when you, by doing some internet reading, you didn't actually start your career with your college education with the idea of becoming a doctor, did you?
I did not.
Okay.
I attended Northern Michigan University, had plans of becoming a biochemist and research, and along the way realized that research was not something that I wanted to do long term. I recognize a great need for that, and I'm grateful for the educators there that provided that education for me, but really had a desire to explore other avenues.
I know you also took a break in your college education to do a mission trip for your church.
I did.
What was that about? Tell us.
Well, that was part of that was teaching people about the good news of the gospel of Jesus Christ, but also that was an opportunity to provide service to communities. And my assignment was in the Florida area in Miami, working in the Latin communities.
Okay.
And
what did that experience mean to you?
Well, for one, growing up in Marquette and moving to a place like Miami certainly is an eye-opener. But culturally, just to become aware that the world is a big place and that there are many cultures and individuals that take part in our world, society, and just helped me, I think, get a different worldview on how to interact and impact the lives of individuals and be of help in some way.
So you eventually got back on track and got into pre-med at Northern, as you mentioned.
I did.
And then got your degree at Michigan State University.
I did. I shadowed with Dr. Alan Olson, an osteopathic physician, and fell in love with that philosophy. Attended the Michigan State University College of Osteopathic Medicine, rotated here in Marquette, did a rotation with Kathy Kroll and the residency program before I ended up at the residency program here in Marquette.
And so you actually went through the program that today you're in charge of running.
I did a rotation with the program that I'm in charge of running today.
Let's talk a little more about the history of this program. As I understand, it started at Michigan State back in the 1970s.
It did. There were some individuals with bright ideas about how to change medical education for communities. The education used to happen in big, large university centers, and Dr. Weston, the dean there, had a great idea about educating students in rural communities. And so back in 1974, these thoughts were put together, and the UP campus was started as an experiment.
Okay.
But one of 3 rural campuses in the country that started in the mid-70s.
So it was one of the initial campuses under this program.
It was.
What were the goals of the program? What were they trying to accomplish?
Well, I think part of the goal was to really address the physician shortage that we have or had in the Upper Peninsula, and to identify local students who could potentially go on to medical school and train in that setting in the Upper Peninsula, and hopefully do their residency training and then come back and stay in the Upper Peninsula of Michigan to practice, to provide for our patient population.
And so part of the philosophy, I guess, is if you expose these young students to an area, they may just choose to stay there.
Absolutely.
And these are the areas most in need, I think, of attracting physicians.
They really are, and those statistics are really throughout the country, where we see that people like to stay where they've trained.
Okay. And as I understand it, are there two separate programs here that are related?
There are. We have the Michigan State University College of Human Medicine, the University Medical School program, and that started in 1974. We've had 300 graduates, close to that number over the last 40 few years, with 27–30% coming back to return to practice in the Upper Peninsula. So when you think of those numbers, there are about 75 to 80 physicians now practicing in the Upper Peninsula of Michigan because of that program. The other program would be the Marquette Family Medicine Residency Program that is sponsored by UP Health Systems Marquette. And that has 6 residents per year for a total of 3 years. They've been in existence. They started in 1979, graduated their first class in 1982. And so we've been running that program with, I think this year brings our total to 204 graduates, and 40 to 45% of those graduates stay in the Upper Peninsula to practice family medicine.
And is that program also in association with Michigan State's medical school?
It is. They are affiliated with Michigan State. They were operating independently until about the year 2000, when the hospital and Michigan State got together and we created, where our corporation agreed with the hospital to manage both the medical education for the residents and the medical students.
Okay, we'll talk more about this in just a couple of minutes. Back with more on the Ryan Report after we take this break. Our guest this morning is Dr. Stuart Johnson. He's in charge of the UP campus of the Michigan State University Medical Education Program. There's not a good short name for all of that, but
there's not.
But it works pretty well. Tell us what these doctors go through. What actually happens here when they go through their residency training?
So as mentioned, these students, they attend their first 2 years of medical education in either one of 2 campuses in East Lansing or Grand Rapids, and then they come to Marquette for their 3rd and 4th year of education. That 3rd year experience, they are doing what is considered core clerkships, or focused areas like family medicine, OB, psychiatry, internal medicine, pediatrics, and general surgery. And so they'll come like it is work every day, and they'll work side by side with physicians. They'll go in and interact with patients. They'll interview the patient, do a physical exam, and they'll come out and they'll talk with their attending physician about that case or about that patient encounter. Then they'll usually go in together, the attending physician with that medical student, and they'll have continued interaction with that patient.
So these doctors in training are really operating as doctors under the supervision of someone who has that doctor.
They absolutely are.
Right.
They're interacting with the patients, they're writing notes, they're learning through that process. There's no better learning than through experience.
Are there still classes at this point or training that goes on?
They do have some educational sessions or lectures, if you will, or one-on-one teaching sessions with those attending physicians, but not many classes at this point in their education.
Okay. Do you have many doctors participating in this program? To make it work?
Yeah, this takes an enormous amount of support from the physicians, from our administrative staff. There are a lot of physicians who volunteer their time, and we couldn't do this work without them.
Okay. So some of these students, as you mentioned, then will decide to stay here. Even perhaps not all of them who aren't from this area.
Yeah, so we've had experiences where people will do their training and not having been from here, and they love it so much. We have such a great culture in the UP that they decide they want to come back and live here. And part of it is because of the interactions with the people, part of it is because of the interaction with the physicians, and some is certainly with interaction with the healthcare team.
We have a new hospital in Marquette, $300 million invested. Will this help attract doctors to the area, do you think?
I sure hope so. You know, this is a beautiful, state-of-the-art, modern facility. There's really nothing that we shouldn't be able to do or handle at UPL Systems Marquette. I'm really excited about what this has to potentially offer for physicians in practice, but especially our population.
You know, as doctors are looking at places they may want to serve, does the quality of the hospital make a difference to them?
Oh, it absolutely does. You know, one of the nice things about the current training model is that new learners, medical students, residents are asked to be engaged in quality improvement projects. And our healthcare system has done a phenomenal job over the last 3 years or so, even longer, just being engaged with quality improvement projects that I think speak to the quality of care that is being provided at our institution. And learners, they want to learn about that. They want to be able to walk into their new jobs knowing how to do quality improvement projects.
As residents, are there any things that are done by your program that allow them to get more involved with the community or encourage them to get more involved with the community?
Absolutely. The medical students are involved with something called the Compass program. They do outdoor emergency education through a course that is offered. They become National Ski Patrol certified. They're also required to participate in community outreach events. Our residency program, many also are inspired to be engaged in different opportunities to improve the care in our communities. For example, some of our residents came together really desiring to tackle this opiate addiction issue in the UP, and have done some really phenomenal things with education and treatment of that disease process.
Okay. I know you have a new program to talk about, and we'll get to that in just a couple of minutes. We'll be back with more on the Ryan Report after we take this break.
Thank you.
Again, our guest this morning is Dr. Stuart Johnson, involved with the Michigan State University Medical Education Program, UP campus. And you recently announced a pilot rural psychiatry residency program. Why is that so important?
So this is a really exciting project for me to be a part of. Why it's so important, you know, one of the challenges that we have in the Upper Peninsula of Michigan is that we have a population of 300,000 people. We should have roughly 35 psychiatrists with that population size to manage some of the mental and substance abuse issues that our patient population faces. And we have about 8 or 1 psychiatrist per 39,000 people. Some of the issues that brings forward, really as a primary care provider, family physician, I certainly manage depression with patients and anxiety and other mental health disorders. But in severe cases, when I need a psychiatrist to help out with that situation, I'll make a referral. And sometimes that referral can take up to, take 8 months to 12 months for that patient to wait for an encounter with a psychiatrist. And so that wait time is far too long for our patients. I think of the increased use of the emergency services or the emergency departments throughout the UP for acute psychiatric illness. And these patients sometimes are waiting in the emergency department for days in order to receive the treatment that they need because there's not an inpatient bed available to them here in the Upper Peninsula. Sometimes they're being treated in those emergency department settings. Sometimes we're transferring them using state funds to transfer them down to Green Bay or somewhere in Lower Michigan. And so that experience does not bode well for for patients, for providers, for families, for our communities.
So this program, which I think is partially federally funded or state funded, will provide some residency opportunities for students here.
It will. So this is the program is it's called MyDocs, or Michigan Docs program. There are 4 universities. One of them is Michigan State University College of Human Medicine that is trying to solve this issue. But these 4 universities have come together and they spend or committed $5 million each year to this program. The state of Michigan is committing $5 million each year to this program. And the federal government is matching those funds, and so it's coming on board with $10 million for this project. And what that does is it provides funding for the entire duration of a residency program for some residents. In our circumstance, 2 residents will begin their training in psychiatry in Lansing, Michigan, and then in 2 years they'll come up to the Upper Peninsula to Marquette, where they will do their 3rd and 4th year of residency training in psychiatry. And the hope and goal is that these individuals stay in the Upper Peninsula after they graduate from their psychiatry residency.
And there are some financial incentives there too, aren't there?
There absolutely are. The Portage Health Foundation, Kevin Storr, their executive director, came to us with the desire to provide funding for that. This is funding for a medical loan repayment, so that if a student receives this amount of $75,000 over 4 years to help offset their medical student loans, likely well and above $250,000. If they commit to stay in the Upper Peninsula for 2 years beyond their residency training, that loan is forgiven. But we couldn't do this program without the generous donation that the Portage Foundation has given.
Okay, sounds very interesting, and certainly certainly the need is great as you've described.
Yeah, it really is. You know, we've partnered with certainly the psychiatrists at UP Health System Marquette. With the psychiatrists, we've talked with the psychiatrists at Pathways, and also the psychiatrists at the VA system. And so we do have some educators, local psychiatrists who are going to be involved in this training. And again, we couldn't do the training without individuals providing that education to our residents.
Okay. Well, thanks for coming in this morning and sharing information about the program. It's certainly well needed and has had a great record here in Upper Michigan.
No, thank you very much.
Appreciate it. I'll be back with some other thoughts for you in just a couple of minutes. The buzz about artificial intelligence continues to grow. Sometimes those in the scientific community just call it AI. It's all about machines that can think for themselves. It's kind of ironic that we're trying to make machines more intelligent when we still have a way to go when it comes to perfecting basic human intelligence, but that's the world we live in. Today, even among some serious scientists, one of the concerns is if we make machines too smart, someday they may turn against us. Keep an eye on your computer for any signs of revolution. The fact is, machines are already at work making decisions that affect many people. If you have a 401k or in a pension fund or you buy stocks, those machines are making decisions that affect your money. In the stock market, they call them algorithms. Algorithmic trading uses computer programs to trade at high speeds and volume based on a number of preset criteria. But they have become very sophisticated. If a senior government official says something about the trade war, we can see a major uptick or decline in the market almost instantly. The same is true if someone from the Federal Reserve says something the market likes or doesn't like. I'm not sure how they're listening, but they are reacting. It's been estimated that in the U.S. about 70% of overall trading volume is generated through algorithmic trading. But machines are behind a lot of other things, and we may not even realize it. Machines have an enormous capacity to sort data, and they're used in many situations we encounter every day. Doctors can use machines to help make decisions about your health. Banks can use the technology to decide if you get a loan. Applying for a job, companies hiring employees use machines to sort through employment applications. You may be using them yourself and not even realize it. It turns out that algorithms influence 1/3 of our purchases on Amazon. And if you've used a dating service, it's most likely a machine is selecting your mate, not some kindly matchmaker. And then there's the type of machine I personally dislike the most, the telephone robot. And make no mistake, while the voice may sound nice, you're talking to a machine. It was kind of okay when the machine simply answered the phone and possibly sent your call to the right person. Now the machine actually wants to talk with you. It wants to know why you're calling and what the problem is and how they can help you. These calls invariably have an unhappy ending for me. Number one, because I don't want to talk with them, and number two, if I do, I never get the solution I'm looking for, even though it could easily be handled if I was talking with a real person. You know, I long for the days when a person answered the phone and they could actually help you with your problem. The fact is, whether I like it or not, we're heading down the artificial intelligence superhighway, and we can't turn back because the machines won't let us. I'll be back in a minute. Well, that's it for this week. Remember, no matter where you are, you can watch our show as it's live streamed each Sunday on UpperMichiganSource.com. It will also be available as part of the Ryan Report collection at that same address. Today's show will be available starting tomorrow afternoon. Thanks to Dr. Stuart Johnson for joining us this morning to provide some insights into Michigan State University's medical education UP campus residency program, which has helped to bring new doctors to practice in the Upper Peninsula. And thank you for joining us. Let's get together again next Sunday morning.